correspondent.
We'll get straight on here with all-cause mortality because we like to start upbeat, don't we?
Well, we
I
have
mean,
to deal with the serious things, Mike, and
well,
none of the other
it doesn't get
mainstream
any
media
worse than
want to
this.
deal with this.
Indeed. Well, actually, for the first time, perhaps we do have a little bit, but let's just look at the right-hand side of this graph. Another week of excess mortality, and actually, the Telegraph has actually got an article finally. Crisis as excess deaths soar to levels higher than during COVID pandemic. So let's look and see what they're saying. Excess deaths in England and Wales are currently running higher than in the main pandemic years of 2020 and 2021. Figures have shown. Throughout October, there have been an average of 1,564 extra deaths per week compared to the weekly average of 315 in 2020 and 1,322 in 2021. They say that the latest figures from the ONS show that the week ending October 21st, there were 1,714 excess deaths in England and Wales, of which only 469 were due to COVID or not, but certainly attributed that way, just 27% of the total. It's 16.8% higher than normal, is what they're saying. But then we get to it. Health experts have warned that some of the unexplained deaths are being caused by collateral damage from the pandemic when operations and treatments were cancelled or delayed as the health service concentrated on COVID. The government's stay at home, protect the NHS message also left many people who needed medical treatment unwilling to bother the health service or afraid they would catch coronavirus if they went into hospital. So if we just keep that one on screen for a second, Debbie, first of all, unexplained deaths is the term that the Telegraph uses, and yet there are no calls from the Telegraph to perhaps investigate the actual causes of the deaths. And the other thing is, in that second paragraph there, they're absolutely highlighting that the behavioural change message or the behavioural analytics message was, well, there seemed to be suggesting was a big part of the reason that people were unwilling to, quote, bother the health service.
Exactly. And I think there are many reasons why people are dying at the moment. But, interestingly, the one thing that's missing there is vaccines. So no mention of vaccines, plenty of mention of delays getting into the NHS. And yes, there are a lot of people that weren't able to access the NHS. And I'm sure a lot of people have died waiting for treatment. We know that there are 7 million on the waiting list, but we're not even mentioning vaccine injuries or serious adverse reactions. We haven't even got an investigation into it. So the whole thing's just being swept under the carpet until we get a full and thorough immediate investigation. We're going to be seeing stories like this speculating all around mainstream media and still no mention of vaccines.
Debbie, I'll just come in a slightly different angle on that. Swept under the carpet, yes, but how's it been swept under the carpet? Well, we've been told for some time that newspapers, media, even the BBC itself put under pressure not to report anything about damage from vaccines. And yesterday I was able to speak to a gentleman who has suffered very severe adverse reactions from an AstraZeneca vaccine. He was in hospital for over 15 months. And the BBC did send a reporter who actually spent some time with him, but that reporter never published, but did say that he couldn't publish because the BBC legal team were adamant that the BBC couldn't report on this. So swept under the carpet, yes, but how has it been done? Well, from the government itself, the government has clamped down on the truth. It's despicable stuff.
Okay, well, let's move on to this then. And this is a notice being issued by the Department of Health under Regulation 3 of the Health Service Control of Patient Information Regulations. And what are they saying? The Secretary of State has issued a notice under the Health Service Control of Patient Information Regulations requiring the following organisations to process information, that's GPs and NHS England. This notice requires that data is shared for the purposes of COVID-19. Effective compliance with the notice will be demonstrated by the use of open safely data analytics platform. So for patients, this means that their data may be shared with these organizations in order in relation to the response to COVID-19. So this is basically in order to allow the government to claim that there are increasing incidents of COVID-19 over the winter period because we're not doing the mass testing program that we had before, but instead GPs are now required to share patient information with a particular register in order to maintain that narrative.
Yeah, I'd say, Debbie, this is something you've been talking about for a long time now, is what is happening to our data. So at every excuse, they are sharing data.
Well, for start off, I know a lot of people that have said no, they don't want their data shared, and yet they're still getting texts and communications from the NHS. So actually, in reality, our data is being shared, and the register that you might be referring to, Brian, is the CPRD, where the MHRA share all GP data. So all of your GP data is being fed straight back into CPRD at the MHRA. So that's just one example, but clearly our data is being shared everywhere. I might just mention the word Palantir, but that's maybe for another news.
Thank you for that, Debbie.